Hi, good afternoon. This is Dr. Ann Kelty with Rooted in Wellbeing, and we are speaking for the health, wellness, and spiritual health and wellness of all of our people in uh, the world. And today I have with us a very special friend of mine. Her name is Rachel Gross Hess, and she is a graduate of the National College of Natural Medicine and the Oregon School of Massage. In her schooling, she focused on the botanical medicine, craniosacral therapy, midwifery, gut health, and nutrition. She has been studying and teaching about diet, nutrition, and the importance of a healthy gut for the last 18 years. Rachel is so excited about the explosion of research and information in the gut-brain connection, the microbiome, and how it impacts every aspect of health. With this focus, she has been able to bridge her passions of gut health and health of babies. Rachel enjoys educating her clients about the power of listening to their bodies and how daily habits can have a powerful impact on their health and well-being. Rachel feels her approach to healing is an accumulation of all her education and life's experiences. Rachel and I met at the National College of Natural Medicine back in the day. It was when we met, it was a very, very small school, and now it's expanded greatly into a university. And so we were both blessed to be in the school when it was very, very small. And so today we're going to talk about the microbiome. Welcome, Rachel.
Thank you. Thank you. I'm happy to be here.
Oh, I am so excited, and I'm so jealous that you're in Oregon where it's warm and I'm in Boston where it's cold.
Yes.
Oh. So can you explain to our listeners what is the microbiome? Because I think people have a hard time understanding probiotics, let alone what is the microbiome.
Okay. Well, the microbiome, when we're specifically talking about the microbiome, we are talking about all of the others. That would be bacteria, viruses, archaea, fungi that live in and on our body. And specifically, the microbiome aspect is looking at not only who or what lives on our body, but also the genetic material that they contain.
That's fascinating.
It really is.
And so why is it important that we look at the microbiome?
So most of the information or studies that's being developed in the last 15 years plus years really began with when they started to break apart the human genome, and they started to discover that the human genome didn't contain as many genes as that scientists or the researchers were expecting, right? We're pretty complex creatures, and when they looked at the genes or genomes of little flies and certain plant species, they have like 30 to 40,000 genes, but humans only contain about 20 to 25,000 genes.
That sounds odd.
Yeah, so how can we as these complex creatures do what we do if we have less genes than a little tsetse fly?
Well, how do we?
Well, that spurred another project called the Human Microbiome Project, which ran from about 2008 to 2012, and their goal was to look at the microorganisms that live in and on our bodies and find out what they did for us. And so when they looked at the microbes that live, again, in and on our bodies, and they looked at specifically the genome of those microbiomes, our human genome multiplied.
Really?
Because when we look at our human organism, we are not just human, we're like a symbiotic being of human and the microbial genes. So when we add in the genome of the microbes that live in and on our body, it expanded our gene potential from anywhere from 2 to 20 million genes.
So what you're saying is that, I think you said 20 million is what we have, opposed to what the tsetse fly has, but adding the microbes in to our genome has actually exponentially changed us, or added to us.
So humans have about 20 to 25,000,
Oh,
but when
okay.
we add in all the genes of the microbes, that expands to 2 to 20 million genes contained in a human body.
That is
So
fascinating.
putting that into percentage, we're about 1% human and 99% other.
That's scary.
It's scary, but it's pretty amazing when you think about it, that we have so much potential that's not even ours, so to speak.
Exactly. And so you were mentioning viruses. I mean, isn't that counterintuitive that the viruses are part of our genome or part of our us, and yet they cause us to get ill too?
They can, and definitely when the researchers are looking and we're talking about the microbiome, typically they're still talking mainly about our bacterial population because that's what they know the most about. And they're still just beginning to look at what the virome is, or the viral load that we have, or the viral components of our whole microbiome. And they're learning how the bacteria and the viruses and the fungi are all interplaying together. And really it's all about a balance, right? There's obviously bacteria that are not helpful for us or beneficial. Mm-hmm. There's those pathogenic ones that we know when we come in contact with, typically they would make us sick, but it's all about the balance. So hopefully we have enough good bacteria or viruses that are going to outweigh the non-helpful ones.
The non-helpful ones, right? And so why is the microbiome so important to us? Besides being a part of what we are, how is it important?
So what they found, again, because we don't have enough genes that would encode for every single protein that our body creates or is necessary for human functioning. Mm-hmm. The microbes actually create or encode for proteins that is necessary for our survival that we can't create. And that could mean, most simply, vitamins, right?
Well, yeah.
There are certain vitamins that we cannot make as human beings, but our bacteria can. Or we cannot digest certain foods, but our microbes can. So, and those come to play in our health.
So part of the studies being done, identifying which of these microbes can help us with which of the nutrients and different parts like the muscles to help support us?
Kind of, yeah. So what they're finding is that, basically they're calling the microbiome like the hidden or forgotten organism, because they're finding like it helps act like a digestive tract, right? Because it helps us digest particular foods, especially those complex carbohydrates that we know we cannot digest on our own, but the microbes digest and in turn transform into short chain fatty acids or B vitamins or vitamin K for us. They act as a second liver because they're really important for helping us detoxify our bodies. They help impact our immune system, and part of that immune system impact is that we start to train it from birth. There are certain sugars in breast milk, which a human infant cannot digest. They're there to actually feed a specific strain of bacteria called the bifidobacterium. And the bifidobacterium, again, digests those milk sugars or breast milk sugars,
Mm-hmm.
and they become entrained and help develop our human immune system.
That's fascinating.
It is. The microbes also are really important in helping us synthesize hormones. They act as a second brain in that they synthesize and help us metabolize our neurotransmitters, which we know are those, brain chemicals which help us stay healthy and balanced.
Exactly.
So in essence, our microbiome has an impact on every single system in our body, and we couldn't function without it.
Well, these are wonderful little beings then.
They are. They are.
Except when they get out of balance.
Except for when they get out of balance.
And so what would cause them to, should I ask you first, what causes them to get out of balance?
Sure. So some of the things that influence that balance, or the type of bugs that we have in the first place: age, our gender to a certain extent, diet is huge, right? Are we feeding the good healthy ones or the non-beneficial ones? And we can talk more about that. Stress, environmental toxins, the illnesses that we've had and how they've been treated in the past.
Mm-hmm.
Those are some of the things that have a huge influence on who's living in our gut or on our bodies.
That is truly, truly amazing. And so how do we get these microbes into our body in the first place?
So that's a good question. Ideally, well, the thought is that when we're little fetuses in utero, right, we're these sterile beings, which is true. We're not eating and digesting food in the normal way that humans do. And they thought that when you were in the amniotic fluid that you were just this, again, completely isolated little individual. What they're beginning to understand is that some of the microbes can actually cross the placenta, and so you start to become not inoculated at that time, but you start to become a little bit environmentally aware. So whatever's happening from that your mother is experiencing, you're beginning to experience, and that's affecting her microbiome, so it's going to affect yours. But the biggest way that we become exposed to this bacteria is through a vaginal birth. And so assuming that our mother has really great vaginal flora, because that's going to reflect on what her gut flora is, and vice versa, we're going to be exposed to whatever she has in her birth canal. And when they look at babies that were born vaginally versus babies that were born by a cesarean birth, mm-hmm. they began to notice that the babies have completely different microbiomes. So babies born vaginally have microbiomes in their gut similar to what a human has in their intestines. And a cesarean baby has a microbiome similar to our skin, because that's going to be that baby's first exposure is through skin contact.
That's amazing. And so what can a mother do to grow her microbiome to support her fetus, but also if she ends up having to have a cesarean section, is there any way that she can actually support the growth or the support of the microbiome internally for this baby?
Definitely. So obviously during pregnancy, diet is huge. So if the mother is eating a high sugar, high simple carb diet, those feed the non-beneficial bacteria versus the complex carbohydrates. And we'll talk more about like prebiotic foods, because those are the ones that are going to feed our good bacteria.
Mm-hmm.
Those are the one. So if her diet is composed mainly of those complex carbs and good healthy proteins and good healthy fats, she's going to have a good healthy gut microbes. If a baby happens to be born by cesarean, because sometimes that's necessary to save the life of the baby or the mother, ideally the mother is going to be aware, and the hospital staff are going to be aware of something that they call vaginal or microbial seeding. So if it's a planned cesarean, a mother can request this process called vaginal seeding. And what that is they take sterile gauze and they put it into the mother's vaginal canal and let it soak up all of her good flora. And then after the baby's born by cesarean, they basically bathe the baby in that gauze so that the baby is getting the flora from the mother's birth canal.
And so how long does the gauze have to stay in the vaginal canal in order to gather enough microbes for the baby?
I think it's only like 20 to 30 minutes. It's not a long, but a lot, sometimes that happens where cesareans are emergency and nobody's thinking of that. Mm-hmm. Or the hospital staff is unaware, the mothers are unaware, because it's not common practice yet. Although some of the hospitals that I've worked with here in Eugene, they do know about it, but the mother has to request it. So if the mother's not educated, she won't know to ask for that. So if the mothers didn't know, or the hospital staff didn't know, the baby can still, she's still going to get, or he's still going to get flora through breastfeeding. So again, the mother's diet postnatally is going to be super important, but there's also some really good probiotic supplements that are specifically designed with the infant strains that are most prevalent in a baby's digestive tract under the age of 1.
Mm-hmm. Okay. And we could find those through a naturopathic doctor, or your physician knows about these, or how does a woman find that?
Most likely through, yes, a naturopathic physician or a natural health practitioner. I'm not going to say that medical doctors, OBs, don't know about this, but from my experience, most are not that educated about probiotics yet. They're getting there. We're getting there.
Little by little, they're getting there.
Yes.
And so if the baby isn't inoculated and doesn't have the probiotics, what happens to the baby then? What does it gear them up for a certain set of conditions or illnesses, or are they not protected as well as the others? What's the importance of having that microbiome at such a young age?
What they've seen in the studies, and part of why the vaginal seeding is beginning to be more of a push among practitioners that know, is that comparing babies born vaginally versus babies born cesarean, what they've seen is that the cesarean babies are at a greater risk for asthma, allergies, autism, obesity, type 1 diabetes, and other autoimmune diseases. So it's super important to have that flora from birth.
That does sound very important to have that in place.
Mm-hmm.
And that includes allergies, I would guess, too. Did you say allergies?
Correct. Mm-hmm. Mm-hmm. I think I did say allergies, but yes. Especially when you consider allergies is kind of on that autoimmune spectrum, right?
Exactly. So what got you interested in all of this?
That's a good question. Well, as most practitioners, when they start to go down one area, it's typically because that's one of their weak spots. Personally, I feel like probably my whole life, it was definitely one of my weak spots. I always had sugar cravings as a kid. Didn't my mom did the best she could, but we didn't always have a lot of fruits and vegetables when I was growing up. So I ate a lot of carbs. And as I started to become more and more knowledgeable about what healthy gut should be like, I was like, oh, my gut's not super healthy. So I started to research for myself, but then also just a lot of my patients, when I was a student doctor, started to come in complaining about gut health.
All right.
And then I started researching and going, oh, well, gut health can show up in so many different ways besides just a disordered gut, right? It can show up as hormone imbalances and anxiety and depression and just low-grade inflammation. And what a great thing that we can actually control what we put in our bodies, because nobody's going to be force feeding us, right?
No, absolutely. Yeah. We have to know what we want to. I guess it's a part of a whole education that we need to start giving our patients too, as to what foods are going to be helpful for supporting your microbiome, what foods are going to be helpful to support your muscles and your nerves as well.
Exactly.
So the microbiome is kind of like the new organ system of the body.
Exactly. Like I said, some people are calling it the forgotten organ because they're realizing how it impacts. So, I mean, again, every system in our body is impacted by our microbiome. It can have it, and I mean, we could talk for hours about like all the little cool, amazing things that they're finding out about, like how certain people metabolize medications differently. And that's because of the microbiomes that they each contain. So the testing is going to become so specified in the future. And right now it's still in its in its infancy, but there are certain companies which are starting to test like what drugs are going to work the best for you. Like if you have to use a medication, shouldn't you would want one that's going to be the most effective without a lot of guesswork? Or what is the diet that's going to be the best for you, depending on what kind of what they're calling enterotype you have. And the enterotypes, right now there's 3 prevalent enterotypes that they've identified, and they have the same basic bacteria in them, but just in different varying amounts.
And for our audience, what is an enterotype?
So an enterotype is basically what are the most prevalent gut bugs in your gut, right? The 2 most prevalent ones that people have probably heard of are I am forgetting the name at this moment. The Bacteroidetes and Firmicutes are the 2 main prevalent types. I'm just trying to see if those are the actual names of the enterotypes. Yeah, so the Bacteroidetes are a species of bacteria that prefer protein and animal fats.
Okay.
And so eating a diet that's prevalent for them, if that's what you have mainly in your gut, is going to be the healthiest for you. And what they've seen is that the Bacteroidetes strain is most commonly found, or most prevalently found, I should say, in people who are naturally thinner.
Oh.
And then there's a strain called the Firmicutes, which are most prevalently found in people who struggle with obesity, diabetes, because those bacteria prefer the simple carbohydrates.
Okay.
And so that, again, having that information in hand can help you gear a diet that's going to be the most beneficial for you. But also, I mean, for Firmicutes, obviously we don't want a high prevalent amount of those, so we can over time change change the ratio.
So if we're having a high level of firmicutes, we can actually start to introduce more of the
Bacteroidetes.
bacteroidetes in, so that then we can change that ratio.
Right.
Will that also help our patients or our clients or our listeners to help with our different cravings?
Yes. Excuse me. Yes. Because those bugs like to, they crave what they prefer. And so think about people with a high amount of candida, which is the most prevalent fungi, right, in our human gut.
Yeah.
They love sugar. And so typically people who have a high amount of candidal species in their gut are going to have lots and lots of sugar cravings.
That makes sense.
Mm-hmm.
And so what can we do to support somebody that has, say, candida or high sugar cravings? Is it a supplementation? Is it diet? Is it essential oils? And how do we start somebody off there, and how do we bring them along?
Well, definitely a combination of all of those I have used. And I think it's going to be super individual depending on the level of dysbiosis or imbalance that person has going on. I definitely like to start with diet and look at what a person's eating on day one, right? And I help them identify the things in their diet that are contributing to this imbalance.
Mm-hmm.
And what are we going to replace those foods that are creating the imbalance? What are we going to replace them with? So we can slowly start to make dietary changes as we're bringing in supplements and or essential oils, depending on what that person feels comfortable with and what is going to be the most beneficial for them.
Okay.
So, does that make sense?
That makes perfect sense. I like that you add something in without taking everything out.
Right. Well, we don't want people to go into deprivation mode, and we don't want the bugs, whether that be, again, candida or the firmicutes or whatever is that imbalance, that dysbiosis, because there's other, bacteria or fungi and viruses that we're still, again, beginning to just know about. We don't want them to go in starvation mode, because then that is going to put that person into high craving mode. And most likely, if this has been an ongoing process, they're already going to be under adrenal stress because, as you know, Anne, and maybe some of the listeners know, when we are eating an imbalanced diet and we've got an imbalance in our gut microbiome, our adrenals are going to be stressed, which already makes us crave sugar, typically, or caffeine.
But there's a lot of reasons why the adrenals could be stressed too. If people are having long periods of pain,
Exactly.
If they're going through into a menopausal state, or their hormones are changing, it's also putting stress on the adrenal glands. Isn't that true?
Mm-hmm. Totally true. And so, again, for me, baby steps with diet is huge, and because I'm looking at the long-term solution, not a quick fix.
Okay.
And working with people and their diet all these years, diet is so loaded. What we eat is so loaded because it oftentimes comes along with a lot of emotional baggage. what our food choices are. And sometimes that's just, this is what I grew up eating, so I don't know any different. I
Yeah.
didn't know that everybody in my family has these same issues because we all eat the same exact diet.
Well, it was funny when you said loaded. I thought you were going to go into the pesticides and the
Uh,
chemicals. I wasn't expecting you to go into the emotional side of it.
yes. Well, that obviously is a huge thing as well, right? Our food is not as nutrient rich as it used to be, and it's depending even depending on the type of diet you have and what food you have access to. Yes, it's going to be loaded with toxins and pesticides and genetically modified organisms and lots of things that are not beneficial for our long-term health.
Mm-hmm.
Yeah. So that's a whole nother factor that we could talk about as far as an impact on the microbiome.
So your first step is to help with diet, taking baby steps, helping them to replace some of the trigger foods for the microbiome,
Right.
and also that's going to cause an um, emotional upheaval or emotional, just people being emotional about all of this. How do you work with the emotions on that?
Well, one of my favorite things to help with the emotions is the doTERRA essential oil company has a set of 6 oils called the emotional aromatherapy blends. I love those oils. I encourage all of my clients to go out or to purchase those oils and carry them with them.
Ah, well, that makes a lot of sense.
Yeah. It's
And,
it's one of the easiest go-tos. I'm like, oh, and they have this, I don't know if you've seen, they have this little emotion wheel, right? And what if you don't know which oil that you need, you can look at, well, what's the emotion that I'm feeling right now? Oh, I'm feeling really anxious. Okay, well, I'm going to go with peace, which is one of the blends.
mhm. Well, that makes it easy.
It makes it super easy. Um, People oftentimes have a lot of guilt, right? When that comes up about
Hmm.
their food choices, or they beat themselves up because, oh my gosh, I've been living like this for 10 years, or, oh, I made a commitment to myself to eat this particular diet, but I, fell off the bandwagon and I had sugar today. Well, the Forgive blend is amazing for helping us to cut that pattern out.
That sounds so supportive for us at the same time.
Yeah. I found it very supportive for myself, as well as most of my clients or all of my clients that have used them have found them super helpful as well.
And so, do you use supplementation as well?
I do. I really love, again, the doTERRA Long Life Vitality Pack. I love that nutrient pack. So what that consists of is the VMZ, which is a multivitamin and mineral complex.
Right.
It has what they call the alpha CRS, which is a great antioxidant blend, and then the Z omegas, which is an omega-3 blend of fish and plant or marine-based and plant-based omega-3s.
Hmm.
And as naturopaths, I was like, oh, I don't need another vitamin. I have access to everything that's great, until I tried these. I have to say, hands down, these are the best vitamins and nutrients that I have put into my body.
I have to say, they're really amazing. I really enjoy them. They really support my body as well.
So in addition to the Long Life Vitality Pack, I recommend the Terrazyme, which is the digestive enzyme complex,
Right.
because we are having most people, I would have to say, that I come across, even if they feel like they're digesting their food well, are not. If you have any amounts of stress, if you drink coffee, you drink alcohol, you are eating in your car on the go all the time, your digestion is suffering.
Oh, come on. Nobody eats in their car on the go.
No.
We're a stay-at-home society. We sit down and everybody eats together now, right?
Yes. Yes.
Right.
So the enzymes are super, super important to help us digest our foods so that we can actually benefit from the nutrients that we're trying to take in. They also have a really great, actually two really great probiotic blends, one called PB Assist and one called PB Assist Junior. I love these probiotic supplements. The PB Assist comes in this double encapsulated capsule that has the prebiotics in there, which are feeding the probiotics, right? Those are the good bacteria.
Oh, yes.
That so that they make it all the way into our intestine where they should be. They're not being destroyed in the acid of the stomach.
Very smart of them.
Yes. And then the PB Assist Junior is a powder. And so typically most people think it's for children only, but it has different strains in there, which are heat resistant. So they can make it through the stomach and the small intestine without getting destroyed, but they have a different blend or a bacteria composition. So it's good to have both the PB Assist and the PB Assist Junior.
Okay.
And there are other, depending on the person, if we are dealing with a lot of dysbiosis, I'm probably going to recommend something like the GX Assist, which is an oil blend that's going to help kill off some of those pathogenic bacteria or non-helpful bacteria so that the good bacteria have a better chance of rebounding.
Exactly. Mm-hmm.
Mm-hmm. But again, starting with diet and starting slowly. If a person's used to eating a lot of simple carbs and sugars, and then they try to add in a bunch of complex carbohydrates, they're going to be suffering because they don't have the microbiome to digest those particular foods. So they might deal with a lot of gas and bloating and huge change in their stools. They can have some die-off reaction, which is going to make them feel like they have the flu, and I don't want them to give up.
Exactly. Now, I know that doTERRA also has a children's line of vitamins and essential fatty acids. So
Correct.
what about adults who can't take pills or don't want to take pills? Can we use those?
Of course. Yeah. They are definitely, the kids line is definitely beneficial. And yes, for some people whose gut is so out of balance and they cannot actually even if they can swallow capsules, sometimes the adult line is too powerful for them to start with. Mm-hmm. So we'll start them off on the kids line.
Okay.
Until they get that more into balance. And then they can choose to switch over or stay with the kids line again if they don't like pills.
Mm-hmm. I know I have some people that are doing the Lifelong Vitality Pack and they're still at 1 or 2 a day a year later. They go up and they just have some other digestive complications. So we're just going very slowly with them.
Yeah. And so, it's important to listen to the body, right?
Yeah. So what kind of testing do they need to have done, or how do we find out where the imbalances are, or is that just through a history? I know, loaded question.
A loaded question, yeah. Well, it again depends on the person. A lot of times, well, it depends on the person. So sometimes I just start with the symptom picture, looking at not, again, just gut health, but I'm looking at their whole symptom picture, past and present. How many rounds of antibiotics have they been exposed to in their whole health history? How were they born? And I might just start a person off without any testing. There are particular instances where depending on if there's possible parasite exposure because of travel or specific symptoms that are not responding to my typical go-to diet and supplement routines, or they're super acute, then I want to know if we're dealing with a specific pathogenic parasite that we need to eradicate with stronger measures.
Mm-hmm. Okay.
So, and then also you can, I mean, there's all sorts of different testing if you have access to a naturopathic physician or alternative care practitioner that's looking at a complete stool analysis to know what you're digesting, because they can tell you how much inflammation is going on in your gut, what you're able to digest, what are some of the bacteria in there. There's some companies that, again, are specifically starting to test for your microbiome so that you know what you have in there. And so those companies are just starting to be, they're kind of still in their infancy, but and I haven't worked with them a whole lot as of yet, but I wouldn't necessarily say don't use those companies if you feel called to do that.
Wow. Rachel, you just have so much knowledge on this area. Do you have like maybe a couple of case studies that we could talk about? Maybe somebody that has, I don't know, maybe rheumatoid arthritis or Lyme's disease comes to mind. Or somebody with diabetes, and your choice.
Okay, I'm trying to think off the top of my head. Should have had a few prepared. Let's see. Definitely dealt with some Lyme disease. And
well, how about something simple that people, some of our viewers can start assessing for themselves, like if they have diabetes or, if they're overweight.
As like even environmental allergies. Or I had a woman that her main presenting symptom was anosmia, right? She couldn't smell. And she's like, my gut is fine. I go to the bathroom every day. I don't have any food issues. And I was like, I kind of think that that's not true. I think that you probably do have some food issues. And so I actually tested her. We did a IgG blood test to look at her food sensitivities. And she came back positive on lots of different foods. So we worked out a diet that was going to work for her, eliminating those food sensitivity triggers. We started working on rebalancing her digestion and her gut. And all of a sudden she could smell she had hay fever. Did I mention that? So she had hay fever and she couldn't smell. And so within probably 2 months, things started to balance. And she was like, oh my gosh, I can smell again. And my allergies went away.
Oh my goodness.
And I can sleep better. And yeah.
And she probably had more energy as well.
And she had more energy as well. Yeah.
So does the microbiome also help with pain and inflammation? I'm guessing it does.
Yes, it does. It's definitely linked to our inflammatory processes. Okay. So having an imbalance or dysbiosis is going to create inflammation in the gut. And we know that that's going to impact, again, inflammation throughout the whole body. So it is one of the new things that they're looking at specifically as far as cardiovascular disease, is that having the right microbiome is actually really important for preventing heart disease.
Wow, that's amazing.
Because of the inflammatory component.
Mm-hmm. Yeah. Mm-hmm. And the inflammation is causing the plaques and the hardening of the arteries and the
Mm-hmm.
blockages in the coronary arteries and the other parts of the body.
Correct. Yeah.
And so how long does it take for somebody to start seeing a difference? You said this woman it was 2 months. Is 2 months, 3 months an average amount of time that somebody would need to be on a diet and supplementation or being aware of their microbiomes situation?
As far as seeing results, or as far as saying that they're healed?
Well, when people start to see results, they feel that they're healed.
Right.
But I think what we're saying is that, people will start to see results and start to feel a shift, feel better, start to see things in their body shifting in a better way in 2 to 3 months.
Right.
And
So
so,
ideally within 6 to 8 weeks, people are seeing a change. Sometimes I've had people like overnight. They're like, you know what? I cut out not even all of my triggers. I cut out like, sometimes I'm like, let's choose gluten, let's choose sugar, and let's eliminate those. And within a week, sometimes people are feeling so much better that they're like, oh, okay. I once had a woman who, it's not, no, we balanced her microbiome too. So she was in her early 60s. She came to me on the recommendation of this chiropractor that I was working with at the time. And he said she's having inflammation. She's basically losing her teeth. She's going up to one of the prominent hospitals up in Portland, OHSU. They can't figure out what's going on with her. All they're doing is giving her steroids because they don't know what to do for her.
right.
And it was at a time that I was really heavily into the gluten research and celiac disease and non-celiac presenting gluten intolerance. And I was like, oh, this woman has gluten issues. And the blood work that you could get through your regular lab for celiac disease came back negative, which is not completely uncommon because you have to typically have a lot of gut damage for the test to be positive for a celiac test.
Exactly. Mm-hmm.
The typical food sensitivity test that I was doing at the time showed maybe slightly that she was intolerant to gluten, but we ended up testing her stool and testing for the genetic markers for gluten intolerance, and she was off the chart positive. So she was then ready to listen to anything I had to say. So we changed her diet. We started balancing her microbiome, healing her digestion, and she was like, oh my gosh, I feel so much better. She's like, I feel better now at the age of 60 than I did when I was 40.
Oh, God bless you. Rachel, you're such a
And
gift to the world.
thank you. Thank you. The inflammation and the ulcers in her gums went away. Unfortunately, she still ended up losing her teeth because the damage had already was too severe to save them, but she stopped having ulcerations in her gums,
Ah,
which was amazing. And that, that kind of got her and her family on this pathway of like, well, what else is impacting my health? So then that opened the door for looking at, not only what are we putting in our bodies, like food and beverages, but what are we putting on our bodies?
exactly.
Because our personal care products, our cleaning products that we're using in our house, are those scented candles or the Febreze that we're using to spray our furniture down, are loaded with chemicals. And if we're inundating ourselves every day with these chemical products, we're going to have a harder time balancing our gut microbiome because those impact the microbiome as well. So then we can, again, we got to start looking at, well, let's start making changes in your household.
Exactly. Exactly.
And And thankfully, doTERRA has a huge line of personal care and cleaning products that now is my go-to of like, you don't know what to use, you can trust these products, like pick and choose. Tell me what you're willing to start with.
Mm-hmm. Exactly. Exactly. You want something that's pure, that's natural, that's not going to cause harm to the body, something that's going to support your body, and something that's safe for your family and yourself.
Correct.
This is what we're looking for. As a naturopathic physician myself and you, we want people to, our first, doctorate is to first do no harm, and
Exactly.
the healing power of nature. And so now we want to get back into what's good food. What can we do to support our bodies? Because as we mentioned before, our food doesn't have the nutrient content that it used to have. And so where we think we're having a good diet, where actually it looks like a good diet. I'm doing these air quotes here. It looks like we're having a good diet.
Yeah.
And the food looks pretty, but what's in it? And I think I understand that once you pick something off the vine, within 3 days, the nutrients are pretty well gone anyway. And so
Exactly.
we're having such a dichotomy of issues here that we're looking at these pretty foods, but these pretty foods are not actually helping our bodies as they used to, as they should. One, because they're nutrient deprived. Two, is they're full of pesticides or chemicals. And also we got to go back to the emotional part of it is where, what's the emotion of the people picking our food? What's the emotion of the people that are actually planting our food? What is that emotional content? What is, how pure is that?
Right. And if you eat animals, how are those animals being raised and how are they being slaughtered, and on and on and on.
It's such an amazingly broad subject. Rachel, so are there any foods that people can start incorporating into their diet so that they can start to support their microbiomes?
Yes. One of the easiest things is, raw or lightly steamed vegetables, right?
Okay.
That's like super easy. We should all be eating how many servings per day? So the complex carbohydrates, like anything in the brassica family, right? Broccoli, cauliflower, kale. There's a whole, what they're calling the prebiotic foods, or those resistant starches, which they're seeing are feeding the bacteria.
Mm-hmm.
So those would be things like Jerusalem artichoke, dandelion greens. What else off the top of my head? There are actually now supplements that are actually prebiotic blends. So for some people, having access to, especially this time of year, right? We don't always have access to fruits and vegetables that are fresh and the way that we want them. Frozen is our second best alternative at this time of year. So sometimes people might choose a prebiotic fiber blend, which is going to feed their good probiotics. Fermented foods. Mm-hmm. I love fermented foods. That would be things like raw sauerkrauts, kimchis, if you like the spice and the garlic, beet kvass or fermented beets, raw cabbage juice that's been fermented. Those are some of my personal favorites. Mm-hmm. Kombuchas, if you like kombucha. If you don't have, sometimes people have problems with the sugar and the caffeine content in the kombuchas if they're super sensitive to those.
Right. That makes sense.
Mm-hmm. Water kefirs are huge here in Eugene, in Oregon in general. I don't know how they've made it out to the East Coast yet, but
A little bit.
a little bit.
A little bit.
So,
Well, of course,
kind
at
of,
Whole
you
Foods,
know,
you can get them at Whole Foods, of course.
right, right. I guess Whole Foods is everywhere now, huh?
They are everywhere. Yeah.
Foods that are really rich in proanthocyanidins. So that's the colorful foods, right? That might be your berries, your blueberries, raspberries, those fruits that have a lot of fiber that balances out the sugar are going to be beneficial. So basically, fiber-rich foods. Make it simple. Super fiber-rich foods, because that's what our good bacteria like to eat.
And so, if people are eating a low fiber diet, so how would you start them? Would you start them at like 15, 20 grams of fiber a day and make sure that they get enough water for a week or two, and then up them to a more therapeutic normal dose of fiber?
Again, yes. To me, I like to do those baby steps.
Right.
Right. So where are you starting from? What's our goal? And how can we get there? And because I don't live in anybody else's body but my own, I tell people, this is what I'm going to recommend. You tell me how it feels in your body. So exactly like you said, are we needing to start at 15 to 20 grams of fiber because you're not getting any at all? Maybe that might be too much for somebody. Maybe it's not. And then, yes, lots of fluids are going to help, because too much fiber too fast is going to be super constipating. Again, because you don't have the microbes that are going to digest that fiber. We don't want someone to feel bloated and backed up.
Mm-hmm.
But yes, so getting ideally up to about 50 grams of fiber a day.
50 grams of fiber a day.
Uh-huh.
Nice.
Yeah.
Then people don't have to worry about being regular, because there's no choice but to be regular.
Exactly.
Oh,
Slowly adding in those fermented foods, if you like those fermented foods.
uh-huh.
And I like, supplements are easy and convenient for a lot of people, right? The probiotic supplements. But one serving of fermented foods contains trillions of colony forming units, and that's the units of how probiotics, or how many bacteria are in a supplement or in a food, are measured, right? Trillions, compared to, in most supplements, they're going to be in the billions.
Yeah,
So if
exactly.
a person likes food, and because I always like to recommend diet over supplements, that's my first choice. But again, I don't always have access to my fermented foods. If I've run out, sometimes I make my own, sometimes I just go to the store and buy some. It just really depends.
And what's a serving? Like a quarter of a cup to start, or half a cup, or?
Yeah, it kind of depends on what you're eating. If you're eating like raw sauerkraut, I would probably start with even something as simple as like 1 or 2 tablespoons if you're not used to eating those types of foods. A tablespoon of apple cider vinegar that's been diluted in a little bit of water is a great way. And apple cider vinegar drinks or shrubs are, making a comeback as well.
That's for sure. They certainly are.
Yeah.
Becoming very popular.
Yeah.
Well, Rachel, this has been a wealth of knowledge. I think we're running out of time. Do you do you have any last tidbits you want to let people know, or how can people get a hold of you for asking more questions, or how do they find you?
Well, they can email me at crimsonspiralkinetics@gmail.com, which there's also a link to that on my website, Crimson Spiral Wellness.
Perfect. Rachel Gross Hess is an amazing naturopathic physician, massage therapist, body worker, healer. I am so excited that you honored us today with coming onto our show, um, and sharing your 18 plus years of wisdom and knowledge. And I know we probably could have gone on for hours and hours on this topic. Rachel, yeah?
One of my favorite topics to talk about.
Well, I want to also thank our our audience today, and thank everybody that comes in and listens to this, because I think this is going to help so many people to wrap their head around what is the microbiome, why is it important, what is probiotics, how do we keep our guts healthy, but also, how do we get our children to be healthy from the start, and how do we give them a step up? I'm Dr. Ann Kelty. I'm a naturopathic doctor. I am in the Boston area. I'm in Cambridge, and you can find me at amnd.com. That's ANNE, N as in Nancy, D as in David.com. And as always, we thank you so much for coming and being a part of our show, and we do hope you join us again soon.